598. Drew, will you read that in for us? Mia, would you read that in for me, please?
Mr. Chairman and members, House Bill number 598 by Representative Green, Miller, and Hilferty provides relative to the medical assistance program of this state known commonly as Medicaid, to provide for duties and responsibilities of the Louisiana Department of Health, to provide definitions and legislative findings relative to Medicaid, to provide for support of inpatient mental health services, and to provide for related matters.
Thank you. Representative Miller, you're not the other ones that they named, so would you tell us about your bill, please? Thank you.
Yes, thank you, Mr. Chairman, and thank you, members, for allowing us to present here today. House Bill 598, Representative Green had kindly agreed, because I was looking like I was out of bills, to be the primary author. But this comes from me and Representative Hilferty. After we've met with advocates, families who have family members with really severe mental illness, and it seems like we have an incomplete system of treating mental illness, and I think everyone agrees that we shouldn't be permanently institutionalizing people like we have done in the past. So we've made moves to have more community-based treatments, more brief stays, but there is in our opinion, a hole for the people who have need of longer-term institutionalized settings, intensive for serious mental illness. And this came out of our meetings with the advocates to try to figure out a way. And we saw that the Medicaid program has a program where you can apply for an 1115 waiver for serious mental illness. Right now, the current program discourages longer-term stays. They limit to 15 days a month, 60 days. The state gets penalized if it is averaging these longer stays, because they're trying to keep people from having to be spending time in these institutionalized settings. But this is a problem for the most severe people who suffer from the most severe cases of mental illness, and this is an attempt to do that. I do know that we have met with LDH on multiple occasions and had conversations with them, and they did explain to them their side of the story and what the challenges are. But I want to bring this to your attention because it is a serious problem. We understand that it is a fiscal note that would require a significant amount of money. It may not seem like a lot of money to some people, given the seriousness of the crisis and given the seriousness of how much it costs our society to have people with serious mental illness having to go, they're being incarcerated, they're homeless. There are costs that are not picked up in there, but we understand that I believe we would have to come up with some money if the state was to implement, to get granted an 1115 waiver. But I'm going to yield to Ms. Janet Sanders, who is here, who has been very, very instrumental in working with us on this issue.
Thank you so much, Representative Miller, and I'm happy to be here. I have a green card that I filled in, but somebody just picked it up.
Please tell us who you are and what you do.
Thank you. My name is Janet Hayes. I'm the director of Healing Minds NOLA, a nonprofit that I created a few years ago to create, explore, and advocate to remove policy barriers to prevent incarceration, homelessness, unnecessary repeated hospitalizations, and death for people living with no fault, untreated, and undertreated serious mental illnesses. And I'm here today to ask for your support to require LDH to include serious mental illnesses in the 1115 IMD IMD demonstration waiver for people with substance use disorders. Why exclude serious mental illness? Much needed and much lacking in the state of Louisiana are longer lengths of stays for people in psychiatric distress, and also a full streamlined continuum of coordinated outpatient psychiatric treatment and care when living in community is the most appropriate setting. Two things the CMS waiver would do. Ask me about a distress call I received from a 65-year-old woman last September who was struggling to work to keep her seriously mentally ill son with medication non-adherence issues in a motel because he was too violent to live at home. At various points in his life, he's been incarcerated, homeless, had multiple involuntary commitments. The only thing he hasn't been yet is dead. We were able to get him into a psych facility in Luling, Louisiana. After 9 days, he was ready for discharge. He was competent, but when I asked about his insight, the doctor said his insight was poor. Various discussions about discharge options led him to being judicially committed. About 2 months later, I got a call from his sister saying he himself was complaining that the group home landlord was withholding his medications, not giving him a key, and that she hadn't given his mother a receipt for the $500 she paid to house him. I contacted the director of the ACT team who intervened. This gentleman has not since had any involuntary commitments. It was the length of stay that actually brought his insight back. Our system works based on knowing the right people to call, who might have the right connections, who might help you if you're lucky. I don't get paid to do this kind of work, yet LDH doles out millions of dollars a year to organizations charged with helping individuals like the family I mentioned. Something is extremely broken here. Do you know where someone needing a long-term stay goes for treatment? Usually the forensic hospital. And you know how to get in a forensic hospital? You have to commit a crime. The state likes to pride itself on efforts to reduce incarceration, but I don't see anyone from the criminal justice system sitting at this committee hearing today. I also don't see the psychiatric experts sitting in criminal justice committee hearings. So good luck trying to reduce incarceration without having expertise, sitting around the table together, needing to know exactly where to pinpoint and mitigate problems. LDH will complain there's not enough money to prevent incarceration, homelessness, and death for your loved ones and our community members. If that's the case, then someone needs to ask just exactly where they are spending our tax dollars, and why aren't they using a federal subsidy to free up dollars to enrich community-based services. The 15-day in lieu of waiver that the federal government does allow for IMDs with more than 16 beds pays for 15 days of hospital care. The state picks up the tab for any additional days. Why doesn't the federal government pay for that and the state use that money to pay for the services that would make it cost neutral? Thank you.
Right on time. Thank you. We have a question from Representative Stagney.
Thank you, Mr. Chairman. I'd actually like to bring LDH up to ask a couple of questions if they have a representative here. So I was looking at I'm sorry, introduce yourself.
Good morning. Karen Stubbs, Assistant Secretary with the Office of Behavioral Health within LDH.
Okay, so currently we're paying about $12 million, almost $13 million of stays that extend above the 15 days, and that cost is taken out of the state general fund, correct?
Yes, sir. That's correct. That's what's budgeted.
So give me your concerns on this bill, seeing as it could save the state a significant amount of money.
Sure. So I would like to start by saying that any of our testimony is not minimizing anyone's personal journey with mental health challenges. We all get into this business because we have those friends and families. And so it becomes a big budget conversation, and I will respond to that. But I think first we need to say, for what the advocates are trying to do, this waiver does not meet. Besides the financial concerns, this waiver absolutely will not extend stays and is not intended to fund long-term inpatient psych hospital stays. Not only is it not intended, CMS is very clear about it and monitors it. So that is probably our biggest point, is that The problem they're trying to get at isn't addressed with this waiver. But you're correct. There is, in addition to this waiver, kind of as a condition for CMS approving an 1115 waiver, they will pay past 15 days for inpatient stays, and in exchange, they will require us to add other additional services. Also, not a bad thing, except those additional services would be added to the Medicaid service benefit array and would cost dollars that aren't in our budget proposal now. So those are the two major concerns. The waiver does not address the intent, and there is a fiscal note attached.
So, does Louisiana have a cap on the inpatient psych stays?
No, sir, we do not. There is no hard cap. It's as simply for Medicaid, 15 days is covered through the Medicaid match, the FFP match. Beyond 15 days, as long as you're meeting medical necessity, there is state general fund coverage for that.
So if Louisiana doesn't need the 1115 waiver for serious mental illnesses, why do other states have them?
So there are 7 states that have mental health 1115 waivers. If you're familiar with Medicaid, 1115 waiver can be for anything. So there are a lot of 1115 waivers. But for mental health, SMI, serious mental illness, there are 7 states. The original intent was for states that aren't in Medicaid managed care. And because they don't have the option to have any days covered through Medicaid. 3 of those 7 states, I believe, are non-managed care states. Louisiana is. So we automatically get 15 days of FFP, a federal match, because we exercise an in lieu of provision, which is a very technical provision. Some states, the remaining, I believe, 4 of the 7, have Medicaid managed care. So they get those 15 days of Medicaid match. But then on day 15, they send people home, regardless if they're ready. There is not an additional funding source past Medicaid. And so you're kicked out at day 15. Louisiana does not do that. So that's a summary of why those 7 states.
So just in general, you anticipate an increase in cost. Can you give me a ballpark figure again?
So we did ballpark a figure in the fiscal note, and I would appreciate a little bit of opportunity to explain that. So for an 1115 waiver, they don't use the word negotiate, but you have discussions with CMS for 9 months. It could be a year. I think Medicaid's working on an 1115 now that's 2 years into it and isn't final. So you have communications with CMS, and they review your current service array, and they tell you these are what we would expect you to include in your waiver. They, for this waiver, look at about 6 different areas. And if we didn't have them, they would likely tell us you need to add this to your state benefit, that your state plan services. Some of those are, for example, supported employment, which Louisiana doesn't have, and in the other, I think, 6 of the 7 states, they had to add it. Case management, crisis services, more community-based outpatient services. And so instead of looking, we didn't have time, and it takes that negotiation with CMS to narrow down every service they would require you to add. But in our conversations with them, they were very clear. We would have to add mental health intensive outpatient. We call it mental health IOP. So since they were very clear we had to add that, we included that in our fiscal note. And the other one is crisis stabilization, which is the bed-based crisis stabilization. We had a concept of how much that would cost. We don't cover that for adults in Medicaid now. So we were able to develop the fiscal note on just those 2 services. That's conservative because there are 4 other categories CMS would look at and likely over the course of 9 to 12 months mandate we add coverage to. So your fiscal note is reflecting 2 services that we feel pretty certain CMS would require us to add. Did that answer your question?
Yes, ma'am. Thank you for your testimony. Thank you, Mr. Chairman.
Yes. And Chairman Miller, before we go any further, you have amendments, and I'm going to get to Representative Miller's question next.
Sure. And I just want to point out, I want to thank Ms. Stubbs for she has worked with us. She's taken our calls, met with us, met with our advocates, or talked with our advocates. And so I really can't thank you and the department enough for that, and we're trying to look for solutions. But I would point out that I think many of the states that have waivers are managed care states. So, but yeah, we do have some amendments, because one of the concerns was the time period that it would take to get the waiver. So I think we would have to change that in the bill.
Okay.
So if you could offer those amendments.
We don't have a quorum. 2, 4, 6, 8. Got 10.
Take my mic off.
2, 4, 6, 8.
My mic off.
Let's see how many you need.
We need 10.
10 of us. We've got 10.
You need 10 more.
Take my mic off.
Oh, we've got 10. Turn them off.
Tim? But
All right. We had a little run in there. Had a flat. We're gonna move your amendment. We're gonna go and offer your amendment. Mia, would you read those amendments in, please?
Mr. Chairman and members, the amendment set before the committee is coded 1911. These amendments have been distributed and are available online. There are a total of 6 amendments that go as follows. Amendment number 1 on page 2, line 20, after 460-103. Delete the remainder of the line and insert in lieu thereof Medicaid covered inpatient mental health services. Amendment number 2 on page 2, line 22, after application and before to authorize, insert or a Medicaid state plan amendment. Amendment number 3 on page 2, line 25, after approval and before by the centers, insert of this waiver application or the state plan amendment. Amendment number 4 on page 2, line 28, change section to section after application and before 4. Insert our Medicaid state plan amendment. Amendment number 5 is technical. Amendment number 6 on page 3, line 2, change July 1st, 2021 to December 31st, 2022, and this extends the deadline to institute the program with federal Medicaid agency, and that concludes the extent of the amendment set.
Thank you very much. And I will move those forward. Are there any objections to the amendments as read? Seeing no objections, those amendments are accepted. I will remind the members that there is a physical note here. It's on your computer if you need to look at that. I've got a question from Representative Miller.
Hey, I have questions for both of them. Representative Miller, what is it that, am I on? You can hear me?
Well, I've got you pushed.
What is it that you're trying to get LDH to do that they're currently not doing?
what we're trying to do is to provide resources for those families who don't have the resources to, for the longer term stays in the institutions for mental disease, those places that are 16 beds or more, or they don't have the resources, they don't have the insurance, and that's kind of what we're trying to get at. And I understand all the concerns from the department, and I agree with, if we had a more comprehensive, it definitely initially it's going to cost more money, but I think in the long term, but short term, the question is, where do we get that money? And that's obviously an obstacle to this.
Well, more than the money, we're trying to find a solution. And I think I heard LDH state that this current waiver does not even pay for the extended care that you are attempting to do. Did I hear correct?
Yes, sir.
Is there another option? Is there an option at LDH? I know y'all already do IOP, so I know you mentioned IOP, and I'm sure we also do crisis stabilization already here in the state, maybe not to the tune that they're requesting. But my question is there, I don't think this waiver is the solution. Is there a solution to help the individuals in the state that they're trying to serve?
So you're correct. We do substance use IOP, intensive outpatient. We actually don't cover mental health IOP, and we don't cover the crisis stabilization as defined in in the way CMS would have us at it. It's crisis, and all those crisis services are often lumped together, but the technical definition of crisis stabilization we don't cover. I did commit to Representative Miller here that we would continue to talk to him. Janet and I go back a couple of years. I consider her a friend, and we have an open line of communication. I think the issue with longer term stay, there is no cap right now, and we do see people in the Medicaid system staying long term in inpatient psych facilities. I think a great kind of area of discussion for us to continue is, should we on our own add things like mental health, IOP, or what other community-based services might help alleviate the need for that inpatient as well?
So you're telling me the only IOP we offer right now is substance abuse?
Substance use. We Medicaid quite a long time ago covered mental health IOP, and that was discontinued 8, 10, 12 years ago.
Schizophrenic patient, those type of things, we do not do intensive outpatient.
Correct. It goes that they have inpatient psych to a community-based treatment, but not IOP.
Wow, yeah, that's something we definitely all need to work on. But damn, that's my time. Thank you.
Yeah. All right. And we're
thank you, Representative Miller.
And going forward, and look, I've been here long enough to understand the implications of doing what we're trying to do when there's a serious financial impact short term, that if this bill were to get out of this committee, then it would have to be recommitted to appropriations, and Chairman Zarang and the Appropriations Committee would be telling me, well, Representative Miller, go find the money. You find $2 million and for I think the next 5 years. So I understand that. And I don't know who else is asked to speak on behalf, but if I do intend to ask the committee to voluntarily defer this, because I know it's not going to be able to get through the process, and but I do want to make sure that we have everybody here understanding and being able to talk about the issue. And
Representative Miller, have you thought about maybe making this in a study resolution? Because I think we definitely need these discussions to continue going into.
We're having discussions, and one of the things that was suggested is having the criminal justice committee members, because none of you are on criminal justice, and I think it goes hand in hand, and so I think maybe a joint committee that can look at these issues and come up with some solutions. I don't prefer task force. I think as legislators, it's our job. If we can invite anybody we want to come and testify and participate in a task force, if we have committee meetings during the interim on this subject.
I know you're going to defer the bill today, and I think the committee is ready to move on, but I would definitely recommend making this a study resolution, and I also think that it may save the state money if we figure out how to do a long-term treatment for this population. So I'd be interested in seeing how the study resolution
I'll be glad to get your help. Thank you.
All right, so at this point, you want to defer this bill, so I'll...
if there's anybody else that would like to speak, I know some people have come a long way, but I thank you for your time, and I'm going to ask that the committee voluntarily defer this.
Thank you, Chairman. I will move to defer House Bill 598. Are there any objections? Seeing no objections, it will be deferred, Chairman, and when you get this in a resolution form or whatever you'd like to do, let us know.
Okay.
Thank you very much.
Thank you for your time.
Representative Landry, House Bill 468. Mia, will you read this in, please?